Welcome back. It's Breast Cancer Month, and we know that 1 in 8 women are diagnosed in the U.S. with breast cancer. But did you know that understanding your breast density and the makeup of our breast can help predict our risk for the disease? Today, we welcome Dr. Haley Letter, a breast radiologist at Mayo Clinic, to share more on this topic and how to reduce risk. Thank you for joining us, Doctor.
Thank you so much. It's great being here.
Yes, well, let's start with something very basic. Remind us who is at greater risk for breast cancer. It can happen to both men and women, as we know, but there are certain ethnicities affected more than others.
You're certainly right. It can certainly happen to all women, but there are certain disparities, especially for Black women, that still do exist, unfortunately. So while white women are actually at a higher risk of being diagnosed with breast cancer, Black women still have about a 40% increased mortality from breast cancer. And that's why actually the American College of Radiology actually recommends that all women, but especially Black women, have a breast cancer risk assessment done by age 30. And that's just kind of to help us identify who may actually benefit from screening younger than our typical starting age of 40.
So that was really going to be my next question, talking about screenings. The going age and for a mammogram, 35 to 40, depending upon who you ask. But sometimes it can be better to go younger even, just to be safe.
Absolutely. Yeah, so guidelines are kind of always changing, but studies have really shown us that we save the most lives from breast cancer if we start screening yearly at 40. And there's really no good time to stop screening either. Guidelines really say to continue screening as long as you're in good health. There are certain subsets of our population, though, that do benefit from screening before 40, and those are usually women who are high risk. And typically women who have had family history of breast cancer who have been identified as high risk, benefit from screening typically before 40. And then there's other subsets of our population that may actually benefit from screening more frequently than just every year. And those would actually include women who have dense breast and maybe some other risk factors.
See, you brought up the next thing that's very important. This is actually an issue that I myself have, a dense breast tissue. How does that affect someone's risk for cancer? It can make screening a little more complicated too.
Absolutely. Yeah. So that's a great question. And it's kind of an evolving topic as well. So breast density, basically what that is all women's breasts are composed of kind of 3 different types of tissue. There's fat tissue and there's glandular tissue, which is what makes milk during lactation. And then there's some fibrous tissue in there that kind of holds everything in place. So women who have dense breasts are actually women who have more of the glandular and fibrous tissue relative to fat. And the issue with density is it's actually kind of a twofold problem. So little cancers on a mammogram actually look similar to the dense tissue. They appear white on the mammogram. So it makes it more challenging to find an early breast cancer. And the other issue with dense breast is it actually inherently in and of itself is an independent risk factor for breast cancer. We're actually kind of finding that up to maybe 1 out of every 3 breast cancers diagnosed in young women may actually be due to density by itself. So it's a very, very important topic.
So we actually have less than a minute, but I think this is important. If someone finds out from their doctor that they do in fact have a dense breast tissue, what is the best way to modify their risk? Should they be screened more often?
So yeah, that is definitely an evolving topic. It's a hot topic in radiology and breast cancer world. So basically, if you are identified as having dense tissue, you will find this out basically because Florida law does require that we notify patients via their letter that they get after each mammogram. So it will tell you that you have dense breast. If you're notified of that, I would definitely recommend talking to your doctor about supplemental screening. And what that means is some sort of screening tool on top of mammogram. And I think there's different, ways to kind of go about that approach, but it may actually benefit you to be getting more screening than just yearly mammogram.
Such important, potentially life-saving information. Doctor, thank you so much and have a great day.
Thank you. Take care.